thanks for I want you to be a little bit careful because there's a 5-minute thing on this sign up here and it's going already. So when the music sounds, you know you used part of my time. So, but thanks to each of you for being here tonight. I'm truly honored and humbled to be inducted into the South Dakota Hall of Fame. Actually, as a transplant to South Dakota at age 50, it never crossed my mind that I might be on this stage. But here's my story. Raised by a great family in Sac City, Iowa, I was fortunate to attend the Air Force Academy in Colorado. Service before self. Service before self was key to our leadership education, and it infiltrated every aspect of my life from then on. After Air Force pilot training, I began flying combat and humanitarian missions across the globe in the C-141 cargo jet, evacuating medical patients and refugees worldwide. Reaffirmed the life of service I had committed to. After the Air Force, I was fortunate, thanks to a loving and supporting wife, to fulfill a long-standing dream by attending medical school in Des Moines, training in family practice, and practicing medicine in Iowa, family practice in Iowa for many years, both rural and suburban. In 1999, Fred Slenica, long-term CEO at Avera McKinnon, asked me to join him as Chief Medical Officer in Sioux Falls. Joining the Avera mission of service to others was an amazing opportunity. So South Dakota, here we came. Not long after our arrival, the book To Err is Human challenged the quality of medicine in the U.S. One suggestion was that any hospital that took care of critically ill patients should have an intensive care specialist. At Avera, we had 28 hospitals, many of them small rural facilities, but only 3 had intensivists. A challenge? Yes. Here's the story to our solution. Shortly thereafter, I met 2 intensivists from Johns Hopkins in Baltimore who had designed a remote telemedicine system to allow one doctor to oversee their 6 critical care units on their campus after hours. The lights flashed immediately. Could that work in South Dakota? Fortunately, Governor Janklow had recently connected all the schools in the state with fiber network, so it was feasible that every hospital could also be attached to that network. So in 2002, we started planning the first rural intensive care telemedicine program in the world. It was the right thing to do. The magic of the system was that every data element involving an ICU patient, monitors, ventilators, IVs, labs, meds, medical records, plus a high-definition camera, were fed into a software system allowing a critical care team remotely to be virtually present in that patient's room every minute of every day. The system would alert the remote team to any changes in the patient's condition. And at that point, the on-site team or the remote team could talk with the on-site team to support that patient back to normal. What we found is that that remote team could actually support 30, then 50, then up to 100 critical care patients at one time with more than world-renowned results. And we were really pleased with that. And that's leverage, to say the least. By September 2004, all 28 Avera hospitals were connected, and on September 22nd, the late Dr. Ed Zawada and his team opened the EICU for business. And at that point in time, 5 minutes later, a patient at one of our small hospitals had a cardiac arrest. The local doctor was still returning to the hospital, so Dr. Zawada helped them revive this patient, and by the time the doctor got there, he was back in good status and ready to move along. Saying nothing about my 5 minutes. So what else? The government said that pharmacists need to review every prescription given to a hospitalized patient before they could get it. Impossible in our small areas especially. Therefore, e-pharmacy came out, one pharmacist doing that for the entire system. And then e-emergency, the same, that board specialized emergency room physicians could tie to emergency rooms throughout for severe trauma and other types of emergencies. And that helped greatly. Our success has actually led to being involved in more than 440 sites throughout the region. I would say that as the world's population becomes more avid technologically, we still have poor access to health care. And I think this is one of the ways that we started here in South Dakota that really can serve the world in a very, very special but remote way. And we're still pursuing that. And again, it all started here. I'd be remiss not to mention the wonderful opportunity I've had to participate in the Sioux Falls Area Chamber over the years, allowing me to see the business community at a much broader perspective and to work with committed leaders, both business leaders and public sector leaders, to make Sioux Falls and South Dakota the best place to live and work in America. Thanks to the Hall of Fame for this honor. Thanks to my wife, Mary Ann, for the loving and supporting a dreamer. Thanks to our children, Carolyn, Tom, Katie, and their families for endless support and love. Thanks to the entire Rivera family who embraced and supported our innovative opportunities to serve our friends and neighbors. Thanks, South Dakota, for allowing me to play a role here. God's blessings to each of you, and that music just came on. Thank you.